Okay, welcome guys. So this is it's just gonna be a walkthrough of the exam paper, following again some further requests for me to have a look at one. So what I'm gonna do is I'm gonna look at the Unit 2 Working in Health and Social Care paper from January 2020. So obviously last year's exam paper. And what I'll do, as I've done previously, is I'll work through the paper. I'll make some notes over here on this side screen of what I might talk about, what you could talk about in a question. And again, as I've said several times, the best thing to do with these exam papers is try and get hold of some past papers from your teachers and just have a practice the questions. It's the best way to get a feel for how the exam paper works. So we're going to look at this paper here, January 13, 2020. All the information on the front is always the same. And again, just flagging up that this is a 80-mark question. So there'll be 4 sections, each with 20 marks. And again, you spend just over a minute per question. So let's get started. So section 8 is always ill health, or generally has always been ill health. And in this context, we've got Angela, who's receiving treatment for breast and liver cancer and will have more tests or follow more tests, has been told that it isn't working. She's terminally ill and she has a husband and child, or 2 children. So first thing it says, identify 2 professionals who are responsible for administering Angela's medication. So these would be people who would perform and provide medication. So in this case, we could put GP, it could be a district nurse. Oh, district nurse. We could be looking at just a nurse, could be a consultant. It could be healthcare assistant. So generally anyone who is going to be coming in and out the home to provide medication. And again, we would just identify those 2 people on the list. Then with 1B, there we go. We are looking at 2 ways health and social care staff can support the family. So again, this is what the role of these healthcare professionals is going to be. How are they going to support the family? So it could be providing information or details for charity groups or organizations and support Angela family. Acting as an advocate for Angela and her family to ensure their needs and wishes are heard or expressed to care team. And again, you could be thinking of anyone. It could be obviously supporting Angela's husband and children, helping them to understand what's happening or the process and health issues. So again, it's trying to think of what they would do. I guess other things could be emotional support or referring to services to provide. So what would these healthcare providers, 2 ways social care could support the family? And again, providing information, providing support, ensuring their wishes are expressed, helping them to obviously provide care or understand what is happening. And again, you would just put your 1 or 2 or your 2 points with a little bit of detail on them. Okay, so for question C, 1C, we've got empowerment. How could you empower someone? So I guess the key things about empowerment is ensuring Angela's wishes and decisions are heard / carried out. Focusing on patient-centered care. So again, focusing all the care on the patient, supporting Angela in making decisions, e.g. possibly providing an advocate if needed. Again, we don't really know if Angela would need an advocate as such, but again, it could be some of these ideas: performing decisions, providing advocates, ensuring that she's able to be in the center or have control over her role. Obviously, again, to empower people is obviously treating them with respect and ensuring their wishes carried out, which actually I realise is already at the top. So put treatment with respect. So again, it's I would say about 3 or 4 ways that you would do this, and again, it's why you would do this as well. So so you could link some of these together, ensuring Angela's wishes and decisions are heard. This makes the care or support focused on being patient-centered. This will support Angela in making decisions, and carers should act as advocate So again, it's just a few ideas of how this would be linked together. Again, treating people with respect. They would be some of the ideas to throw in there. And 1D is the last one here. So again, discuss the possible advantages of hospice care for Angela and her family. So the main benefits of hospice care obviously means that she has 24-hour support, medical staff are available to administer and review medication as condition/illness changes, comfortable environment. Obviously, there will be support services on site or at the hospice to provide Angela with information, but also can provide additional emotional support, emotional and mental health. So again, these would be some of the benefits of providing these different levels of support. I don't know why it keeps changing that to comfort. We'll leave that. Oh, there we go. My spell check has been turned to French for whatever reason. That explains why it's having troubles and why it's spelling everything wrong. Okay, so that could be other things we can think about. So discuss possible advantages of it. So medical staff on board to administer and review medication, illness changes, comfortable environment, support services available for there. I mean, obviously, however, there is an element of being separated or isolated family, which could distress. So again, it's the idea that the advantages are there are a lot of advantages to going into a hospice, because again, 24-hour support, medical staff can dare, all the things you've mentioned. However, it's also worth just flagging up that, you know, there are some concerns and some things, so obviously with Angela being separated from family, that could be upsetting for her. And again, it's, I'd say about 3-4 points with an explanation would be sufficient there. Okay, we then move on to section B. So we've got 2A. We'll start with a new scenario. This is all about learning disabilities. And it says Jessica is 19-year-old and has a moderate learning disability. She's supported to live independently and has been living with her partner for the past 12 months. Jessica has recently found out she's pregnant, and she and her partner are looking forward to becoming parents. So it says identify 2 health settings that could provide Jessica care. So again, these would be places, locations that would be used. So we can use GP practice. Obviously, that would be obviously where Jessica would be going to get support. We could also maybe include maternity ward at hospital. As again, if you are pregnant, you'll be provided with support at your GP practice in a normal non-COVID setting. But also your local local hospital will have a maternity ward where you'll have to go for scans and appointments. So again, these would be 2 settings that would generally provide support. Because Jessica has learning disabilities, we might also want to consider sort of maybe if she goes to day centres or other sort of environments that support people with learning difficulties. But I think these 2 will be fine for now. Then we have 2B. So describe 2 ways Nursing and Midwifery Council regulates Jessica's midwife. So again, the role of these sort of councils, or the Nursing and Midwifery Council, it's about regulating behaviour, staff conduct. So it will set codes of practice and guidance or standards or treatment, or sorry, for all staff or carers. It will review and monitor progression. Part of it is to ensure that, you know, staff are engaging in continued professional development. Also, there's a revalidation process where obviously you have to regularly review license and demonstrate to date. Training. So again, these would all be some of the ways that Nurses and Midwifery Council, or any of the sort of ruling bodies, governing bodies when it comes to healthcare, will look at that. They set the standards, they provide the principles of care, they will make sure that staff are reviewing their training, they have to engage in regular CPD, they have to revalidate and re-certify, I think it's every year, to ensure that they are working within the expectations of the healthcare setting. We've then got 2C. So explain potential. We've got here potential barriers that could affect Jessica's access to health and social care services. So barriers to care. So again, with this, we may think about obviously how it would be difficult to access. So it could be understanding and awareness of services. So that could be a barrier. We might have transport issues, so practical barriers. Could be communication challenges, and lack of support / advocates. It could be sort of concerns about being judged as due to having a learning disability, may be concerned others may not think she could be a fit mother. So it's kind of thinking, what would be the barriers? What would potentially stop Jessica from seeking advice or seeking support from health and social care services? So I think, yeah, I think understanding awareness of the services available to her, transport and practical ways of getting to services, communication challenges potentially from obviously lack of support, maybe lack of advocates, and maybe feeling concerned or that she'll be judged or face prejudice or discrimination because of her learning disability. These will all be things that may stop someone from seeking support. And then 2D, discuss how midwife would support Jessica. So the role of midwife, think about what the midwife will do. So they will monitor growth and development of baby throughout pregnancy, will provide advice and support for mothers during pregnancy, obviously they will conduct, or they will take, they will run tests, health checks, they will support mothers during labour, and then we've got sort of post birth, so can provide support with breastfeeding, early care, and obviously they will provide or perform health checks on the baby. However, obviously the question is about Jessica, so maybe we can kind of scrap that one. This is obviously about her. So support with breastfeeding and early care for the baby. So these would be all the things that midwife does. Again, with this question, it's to discuss, so we're just putting our ideas out here. No need to evaluate it as such. But I mean, again, this is more about what the role of the midwife is. So it's not as much flexibility and room to question or challenge how good the support is going to be, because it's more about what is the role. But there'll be enough of the things to talk about there. Move on to 3A. So a new context now. So this is always the physical and sensory disability section. So in this case, who is going to provide support? And obviously we've got a new case study. So we've got one about hearing impairment that has declined or got worse over the last 10 years. The individual's fallen and broken their hip, and they've had a hip replacement and they're recovering well, and they've got a physiotherapist who sees them every day to ensure that he can mobilize himself following his hip replacement. He lives on his own and has only recently retired. So charities that could support, I think it's Leiden there. So again, because of his obviously hearing impairment, we could talk about sort of societies or charities that would work with patients or individuals who are deaf. Charities, organisations working with those who are hearing impaired. So obviously I'm thinking like the Royal Deaf Association, the RDA. They could be sort of some of these organisations that would work with them. Other charities, I guess, because of Leiden's age, we can maybe think about age-related charities. It could be home help organisations. So I guess it's trying to think specifically about to there we go, and I've made a common rookie error of exam papers. I haven't read the question properly. So again, it just highlights you need to read that question properly. So 2 ways charities could support Leiden. So there we go. So we can go with providing information on local support services and groups, provide funding or donations, support independent living, run local events and activities that Leiden attend. There we go. So again, it's highlights need of reading the question properly before you start writing. Okay, so that would be 2 ways. Again, 2 things they could do. Describe 2 responsibilities for doctor working with Leiden Hospital. So responsibilities of doctor is to, obviously their role is to monitor health and recovery, to record treatments and procedures, they would be involved in making decisions about care. So again, just come off say what are some of the responsibilities of a doctor in a hospital or in this setting, and then again all we need to do is just explain what these things are. And then 3C, so explain how staff at the hospital are monitored to make sure that Leiden receives high quality care. So again, this is all about monitoring and assessing care settings. So again, you can talk about I missed off half the word. So we can talk about organizations that monitor care practices, such as the CQC, regulatory, ensure staff follow a code of practice, staff have to engage in regular which is recorded and monitored by senior staff members. Obviously, again, there'll be an open complaints process. Patient concerns to be. So again, it's just thinking about how staff are monitored, and again, it's stuff we've potentially touched on as we worked through this. And then multidisciplinary teams for 3D there. Explain how a multidisciplinary team can support Leiden to live home. So again, this would be working to ensure all needs are met. Also, they can share resources and provide full I'll say holistic support for Leiden. So again, all needs are met. So that's obviously when we talk about holistic support, that's physical, emotional, social. So again, it's full care. So it would potentially reduce risk of repeated care. So again, it's all one organisation providing the care rather than multiple agencies. So it means that there shouldn't be any gaps in care. It reduces the risk of repeat care. It can obviously means that adaptations could be organised, provided. So again, the idea being that this should cover all of Leiden's needs to allow him to remain supported at home. So again, it could be thinking about stuff like home care, healthcare assistance, home adaptations, community support, some of the things that could be arranged. And then last but not least, move on to section D. So 4A. So we've got Jake, who is 6. So age-related needs, we're looking at children here. Jake is 6. He has a long-term health condition, so he has to stay in hospital for a few days each week. Jake lives with his parents and his younger brother. One of his parents stays with him while he is in hospital. So identify 2 skills that Jake's doctor should have. So if we can think about our 6 C's. That would be to think about skills. So obviously we're going to need communication skills, obviously to talk to children. Obviously they may need patience, because obviously challenges of treating children. Calm, again, whether these are 6 C's or we also look at people skills. So again, calm, which does overlap with having patience, not patience. Calm, maybe even think about the sense of humour. Leads. So again, it's just 2 skills that you would consider a doctor to have. Describe 2 responsibilities of the hospital to ensure that workers meet national occupational standards. So again, clear, it's very similar questions about this sort of clear codes of practice and sort of working regulations, senior staff to ensure hospital staff engage with CPD. Check qualifications. Ensure staff are trained in risk assessments. So again, it's just coming up with a selection of ideas. Let's put 4B. And what I'll do is I'll look through the mark scheme in a second as well. We can kind of double check some of these ideas that I came up with. And then we move on. So 4C. So explain how Jake can be kept safe while in hospital. So again, this would be ensuring all staff have received safeguarding training, environment, safe and there are no obvious risks. So obviously this would also link to having conducted a risk assessment. There'll be sort of sanitation. Cleaning. Obviously in terms of meals, obviously staff aware of allergies and medication. So these, again, some of the things that we've done. So again, secure environments, safeguarding training, risk assessment, sanitation. This would all be ways that we would keep children safe or keep anyone safe. It's almost think about like when you're in school, what teachers have to do to try and keep you safe and secure. And then last but not least, we move on to 4D. So again, discuss the importance of good communication between professionals involved in caring for Jake. So again, it's important to share practice and treatments that have been provided. So again, this is ensuring that records and medical notes up to date. So this obviously avoids duplicate or missed treatment or medication. Obviously, it means that there's obviously discussion for best treatment. And all Jake's needs are met. Obviously, it's a sign of good practice as well for professionals. So it's a sign of good practice. I suppose it's obviously communication with Jake and family. So again, it's the respecting patient needs and wishes. So these would be some of the things that would mean this is important. So again, shared practice. Why it's important to make sure treatment and medication isn't missed or duplicated. Obviously, provide discussion on best treatment. So again, obviously use of again that multi-disciplinary team. So again, that's really going to be good practice. Obviously, it's a sign of good practice, and obviously it's part of code of conduct to communicate, share information. So again, that's a key part there, and also communication potentially with Jake and his family to respect his wishes. They would be some of the communication skills that we might need to see. And again, some of the kind of key ones there. Right. So let's take a look, if I can call it up. There we go. I want to open this. There we go. That was a bit of more effort than it needed to be. Okay. So let's hide toolbars. We'll hide this, and we'll move it over here. Thinking about our questions. So again, didn't do this last time, but we'll quickly look at some of the answers that I wrote just to double check them. So this is the first one about who would be working with our case study character of Angela. GP, doctor, consultant, nurse, district nurse, palliative care nurse, nurse practitioner, healthcare assistant. There we go, we've got all of those. Section B was the question asking describe 2 ways social care staff could support the family. So again, the suggestion there was provide care and support planning, referring to charities and groups that could provide support for emotional needs, provide advocates to get the family's point of view across, provide information so they're aware of medical progress, respite care. There we go. So it says do not accept health roles. So anything to do with providing medication, which we haven't covered here. We've got, I think, we've kind of got all of the points they made in sort of roundabout word. And again, appropriate response. I think that accept any appropriate response was a good part of these mark schemes. It helps us out a lot. Okay, 1C, jumping back and forth from the questions. Explain how staff could empower Angela. So the empowerment here, provide Angela in care planning, provide person-centered care, promote her rights, make sure she understands what's happening, respect dignity, promote dignity, meet her needs, and provide support and treatment that meets Angela's beliefs, cultures, and preferences. So again, wishes and decisions, support her understanding, help her make decisions, act as an advocate, treat with respect. Yeah, we're kind of on the right lines. The main thing about this is, again, you're making your points and you're linking it back to Angela and mention her throughout your answer. And again, just explain anything to ensure you have made your point clear. And then for 1D, discuss possible advantages of hospice care for Angela. So qualified professionals available 24 hours a day. Decisions about making healthcare can be put in place quickly so she's not in pain. Respect her wishes, provide family support, offers respite, offers personalised care, additional support from volunteers, 24-hour access for the family. Okay, so there's some ones I didn't pick up on, but as I say, this isn't an exhaustive list. You don't have to put all of these. I would say 4 of them with a little bit of an explanation, I think would be enough. So again, the points you made here kind of cover it. Again, looking at the sort of the marking grid, it says clearly displays logical reasoning. You've made a clear list of points relevant to the context, accurate knowledge. I think that would be sufficient. You don't necessarily need to put an evaluation in there, but sometimes it's quite good, I think, to reflect both sides of what's happening. Okay, then we move on to 2A. So this was about Jessica, who was pregnant and has learning disabilities, and it was a little question about who would support her and how they would be supported. So settings that would help: GP practice, surgery, healthcare setting, hospital, clinics, antenatal, community. So again, being specific, obviously maternity ward kind of comes under hospital, or maternity ward or hospital, so that would be accept. It says do not accept professionals. So in this case, you wouldn't say midwife or GP. You would have to identify a setting. And then 2B was the midwife question. So again, how it regulates the midwife. So evidence of CPD required to maintain up-to-date knowledge, ensure revalidation, complaints are followed up, qualifications checked, set codes of practice. So again, I think all points set codes of practice, review progression, revalidation. I think we've touched on all of those. 2C. So again, this question was about barriers to accessing services. So what could be the barriers for Jessica getting access? So specific needs, support available for individual needs, individual preferences, financial, geographical, social, cultural. So really, when you looked at barriers, you would have talked about individual, financial, geography, social. Again, you wouldn't necessarily have to identify the specifics. I think, as we said here, understanding awareness, transport acting as a barrier, communication challenges. I think if you put, say, 3 or 4 of them in and explain them, that would be sufficient. And then 2D, was all about how the midwife would support Jessica. So again, I think we kind of came up with a lot of the points here. So provide advice during pregnancy, information about the fetus, baby development, provide advice and carry out monitoring for pregnancy, support Jessica and her partner to put a birthing plan in place, parenting sessions, information on labour, support Jessica during labour, advice on how to support and care for the baby, observe partner Jessica and partner breastfeeding or feeding, bathing and changing, and liaise with professionals. So that's the only one. I think liaise with professionals we kind of missed off there, but I think most of them we've kind of covered in our discussion. Moving on to 3A. So these are the questions focusing on Leiden and his hearing impairment. So again, charities. Now this is one I, again, misread the question and was trying to think of two specific charities. Obviously, it's looking at how the charity would support. So provide an advocate, provide information, provide equipment, provide support groups, provide healthcare services, provide emotional support, which we've got there. 3B, we're looking at describing two responsibilities of a doctor working in the hospital. So again, provide information, monitor health and recovery, record treatments, decision makings about care. We've got prescribe treatments, talk and examine Leiden, carry out procedures, make notes, prepare paperwork, liaise with the medical team, promote health education, teach and supervise junior doctors, and follow policies and procedures. So again, with this list kind of goes slightly beyond specifically treating Leiden in terms of teaching junior doctors. But again, it seems to be quite a good list of ideas that you can use. Then we've got question C. So how staff at the hospital are monitored to make sure that they're providing both care. So we talked about monitoring and assessing care settings, the organisations, regulatory bodies, staff engaging in regular training, open complaints process, and the suggested ideas we have. Line management, one-to-ones appraisals, observations, CPD records, service user feedback, complaints, feedback from external inspections, whistleblowing, criminal investigation. So I wasn't bang on the answer there, but I was on the sort of right area in terms of what I came up with. And then lastly, 3D was about multidisciplinary teams, and again, the benefits of using them. So I talked about working to ensure needs are met, the holistic approach, reduce risk of repeat care, adaptations, home care, and again, range of specialists, holistic care, no gaps in provision, he's involved in decision making, access to an advocate, renewal of plans, and promoting his rights. So again, a few ideas I didn't touch on, but again, some of those I'd already covered. And in 4A, what would be the skills a doctor working with young children or younger children would need? Big list here: problem solving, decision making, communication, analytical ability, compassion, patience, organisation, monitoring. So basically, it's pretty much anything from the 6 Cs or people skills that would be needed. And again, accept any other appropriate wording, except specific examples. So quite a good sort of set of information there. 4B was describe two responsibilities of the hospital to ensure its national occupational standards are met. So staff development sessions, policies and procedures, make sure staff are aware of codes of practice, interview process, complaints and whistleblowing processes. Again, I don't think I was necessarily as on top of that one, but clear codes of practice, ensure staff engage in CPD, check qualifications. Okay, maybe I've got some of them here. And ensure staff are trained in risk. So again, I'm on the right lines, but as I say, I'm a little bit rusty with my unit 2. I haven't taught it for a little while since lockdown. And then lastly, 4C, or nearly at the end, 4C, was asking about how Jake can be kept safe. So the things to do: risk assessments, policies, procedures, safeguarding, regular training, monitoring of staff, monitoring of visitors, complaints, monitoring infection control, adequate PPE, confidentiality and accurate record. So again, I kind of focus more on Jake specifically on the ward, but there's other stuff there about his confidentiality and information. So again, there's a little bit more freedom with that. But as I say, it says, you know, this is not an exhaustive list and any other plausible content. So again, these questions always give you that little bit of wiggle room to go beyond, or as long as your points make sense and are realistic and rational, they would and should be accepted. And last but not least, 4D. So discuss the importance of good communication between the professionals involved in Jake's care. So I focus on sharing practice, multidisciplinary teams, communication with family, and it says improving information, ensuring holistic care, planning and commissioning of care, maintaining confidentiality, Jake's rights, safeguarding, involves Jake and his family in planning accurate records. So again, I didn't pick up on some of those points. As I say, I've got some of them over here, but I haven't done unit 2 for a little bit. I haven't really touched up on that so much recently. So there we have it. So a little talk through of the paper and some of the key points. Hopefully this has been of some use. I know, again, my questions weren't bang on, but as I say, you know, I'm not perfect, but hopefully you've got a little bit of a sense of what the paper is going to entail and what you need to be doing in terms of preparing. I'd say the key questions that seem to come up is the kind of responsibilities, the safeguarding of professionals, the role and responsibilities of professionals, the key figures that will provide different forms of care. These are the things to look at. Make sure you are looking at those because they seem to come up a lot, and also definitely things to consider. Okay, I hope this has helped, and thanks for watching.